Thanks to everybody for joining us. We have 3 doctors and leaders here to talk about Children's Wisconsin's response to the incident in Waukesha yesterday. They are Dr. Michael Gutzeit, Chief Medical Officer at Children's Wisconsin, Dr. Amy Drendel, Medical Director of the Children's Wisconsin Emergency Department and Trauma Center, and a Professor of Pediatric Emergency Medicine at the Medical College of Wisconsin, and Dr. Michael Meyer, Medical Director of the Children's Wisconsin Pediatric Intensive Care Unit and Chief of Pediatric Critical Care at the Medical College of Wisconsin. They will be giving us some information and then answering questions in the comments via the comments section on Zoom here. Please put any questions into those comments and we'll read them off to the team at the end. They are going to start with some opening comments and we will start with Dr. Gutzeit.
Hi, I'm Mike Gutzeit. I'm the Chief Medical Officer at Children's Wisconsin in Milwaukee. Last night, our community was impacted by the tragic and intense incident at a holiday parade in Waukesha, Wisconsin. Our prayers and thoughts are with the victims and loved ones during this very tragic time. The children's team responded with their head and their hearts to provide the care and support to children who were injured, their families, and our teams. While we always hope this will never happen in our community, as the region's pediatric trauma center and the largest provider of critical care services in the state of Wisconsin, these are events that we prepare for. Some basic patient information is that 18 children were brought to the Children's Wisconsin Emergency Department last night. My colleague on this call, Amy Drendel, who's the medical director for the Children's Wisconsin Emergency Department and Trauma Center, will share more about our initial response. And then Mike Meyer, the medical director of the Children's Wisconsin Pediatric Intensive Care Unit, will provide a summary of the patients currently in our care. We will not be answering questions regarding any specific conditions of the patients. I'd like to express a sincere note of gratitude. Before, I want to emphasize and express thanks to the community for the effort in their response. That begins with the gratitude to our law enforcement who responded to the incident and was able to secure the incident. I want to commend the efforts of the emergency medical services responders and other local hospitals who successfully stabilized patients before transporting or transferring kids to be cared for by our pediatric specialists. And we offer our support and gratitude to the teachers, the staff, and all the school districts who will be supporting kids and families who were involved and impacted at this event. The injuries from Sunday night will go well beyond the physical and will take time to heal. We all must continue to lean on each other and to encourage those impacted to reach out and use the resources that are available to them. Each of these injuries impacts a family, friends, and a larger circle beyond those immediately injured. With that, I'm going to turn it over to Dr. Amy Drendel, the medical director of our Emergency Department and Trauma Center.
Thank you. As an emergency doctor, we're trained for these types of incidents, but you never want to experience them. I want to start by sharing my sympathy to all those who've been directly involved. Children's Wisconsin is a large pediatric emergency room, and we are uniquely equipped to support an event like this. Sadly, like many communities, our region has experienced mass casualty events in the past, but none in the recent history involving such a large number of children. Law enforcement promptly informed us about the incident soon after it happened, and we received our first patient at 5:30 p.m. yesterday. Beginning at that time, we activated our trauma surge plan, calling in nurses, doctors, surgeons, and other team members to help support the care of these children. 18 kids were brought to our Children's Emergency Department, ranging from ages 3 to 16 years of age, which include 3 sets of siblings. Injuries ranged from facial abrasions to broken bones to serious head injuries. 6 of these patients were sent to the operating room last night, and 2 additional patients are undergoing surgeries today. Roughly around 9:30 last night, the patients we saw were triaged and being sent to patient care units, and the Children's Emergency Department started to transition to normal operating conditions. I'd like to echo Dr. Gutzeit's appreciation for all the first responders who were fantastic. We all have a role to play in this situation, and I am proud to be a part of this community and how it responded so well to the needs of these kids. With that, I will turn over to Dr. Meyer, the medical director of the critical care unit here at Children's Wisconsin.
Dr. Meyer, you are on mute.
Good morning. You would think after this many months of Zoom, I could figure this out, but thank you. Dr. Drendel, as said, we're immensely appreciative and thankful for the response of our community. The medical response started on scene with bystanders, EMS, and then our community partners and other healthcare organizations before the children arrived here at Children's. As we've stated, is Children's Wisconsin has the largest pediatric intensive care unit within the state of Wisconsin. We have 72 ICU beds. And like our emergency department, we immediately began preparations to receive patients once we were notified about the incident. From a patient standpoint, there were 18 patients who came to Children's and 10 of them were admitted to the pediatric intensive care unit. I'll briefly go through their conditions, but will not share any specific details about individual patients. Currently, we have 6 patients who we list in critical condition, 3 that are in serious, and 1 that is in fair. We also have 8 other patients that are listed in fair condition that are not in the intensive care unit and are in other units within the hospital. As Dr. Drendel noted, I think it is very important, and it really responds to the family of this situation, is that there's 3 sets of siblings that are currently hospitalized within Children's. And this is unique and truly demonstrates the devastating effects of this on our community. Mental health support has been activated for our families, our children that are involved in this, and also our staff. Social work, mental health teams, and our chaplain teams are all actively rounding in the intensive care unit, as well as other units in the hospital. And it is amazing to watch them and our medical care teams work as a single team to help our families and our children. I'm immensely proud of the teams that we have here at Children's, and I'm amazingly proud of the community that we serve in and that we live in.
Okay, and we are going to take questions now in the chat. Before we do that, I just want to note that Children's Wisconsin has established a mental and behavioral health support line for families who need emotional support. That line will be active at noon today. That number to call for emotional and mental support is 414-266-6500, and that will also be pasted into the chat so that you can grab it. Okay, let's start with some questions. So Dr. Drendel, we have some questions about the initial response to the incident yesterday. Can you talk about what that meant for our teams and what it looked like?
Thanks for that question. We have a surge response, a disaster type response that we practice and is part of the care that we provide in our emergency department. The initial notification gave us the time to bring together the nurses and doctors and providers that would be needed to be able to take care of the large number of patients in a short period of time. And our team was ready to receive those patients. I will like to point out the patients were extremely well cared for in the field at the initial hospitals. The stabilization was exceptional, and these kids got fantastic care from start to end. Our team responded well, and we were able to position them to the specialty care that we provide here at Children's in a way that should provide the best possible outcomes for these children.
Okay, and we heard last night that potential blood donations were needed. Can anybody speak to whether or not we need blood donations currently at Children's Wisconsin?
Thank you for the question. This is Mike Gutzeit. Yes, blood is always needed. It's a precious commodity, and during actually even the normal operations on a day-to-day basis, blood is valued and appreciated because of the blood products that are necessary to do the complex care for patients that are at Children's. I would say in situations like this, there can be exceptional needs for blood. So if anybody's interested in donating blood, contact the local blood donation centers, and please take advantage of that.
Okay. And to reiterate, if someone wants to donate blood, they should go to their typical donation site.
Correct.
Okay. Have all of the patients been discharged? Have any of the patients been discharged, or are all 18 still in the hospital? I think Dr. Meyer addressed this. Dr. Meyer, do you want to jump in on that?
Yes, thank you for the question. As of right now, 2 children have been discharged. We are currently making determinations about the ongoing care of the children that are in the intensive care unit, as well as the other care areas in the hospital, and would anticipate that discharges will go through an orderly process as we continue to assess injuries, as well as the mental health and well-being of all of the patients involved in this.
Okay. For the patients that we saw, have we made contact with the family members of those patients at this point?
Yes, the Children's Wisconsin staff have made contact with each of the families, or families for each of the patients, and have provided support for those families during this very challenging and tragic time for them. And that will be an ongoing connection point to guide families through what resources they need during this time.
Okay. Dr. Meyer, this might be a tough one. I'm not sure if you're able to answer it, but do we have any information about which groups of people were admitted to our hospital here at Children's Wisconsin? So I know that, there were different marching bands and dance teams. Do we have any information about who those people were that were admitted to Children's?
Unfortunately, much of those individual pieces are still being sorted out. There was a wide variety of different participants in the parade from some of the groups that have been identified in the news that were present and were potentially involved. I would say that this has impacted a great number of members of our community and the groups that participated in the parade.
Okay. And then Dr. Drendel, did you receive patients who were conscious and understanding of what happened last night? Someone from media is asking if we have patients who really understand what happened.
We received patients with the different levels of injuries. Some were conscious, some were not conscious. Their experience and recollection of the events isn't clear to us based on our emergency department evaluation, but will clearly be a part of our ongoing care here at the hospital.
Okay.
I'd like to emphasize this is one of the unique aspects of a pediatric organization that has all the resources to provide support beyond the exceptional care that Dr. Drendel, Dr. Meyer, and the rest of the teams do. It's providing those social workers and others, child life specialists, other specialists who can wrap themselves around the family, provide the support for the patients, and understand the needs of the child depending on the chronological age and development of the child.
Okay. Do we know if this will be for Dr. Drendel, do we know if the children were transported by ambulance or driven by civilians or a mix of both?
I would say the vast majority of the patients that we saw arrived by ambulance. I think most of them came from the nearby facilities, Menominee Falls and Waukesha. Both initially evaluated these patients and identified them as patients who needed a higher level of care and transferred to our facility for ongoing resuscitation and management.
Okay. And as a reminder, as we're taking questions, we won't be able to speak to specific patients or patient information. We can just give those general updates. So someone asked about our facility offering mental health services. Dr. Gutzeit, I think you just touched on that. Do you want to touch on that again?
Yes. And again, we really appreciate the emphasis on the need to support patients and families beyond the injuries that have occurred. So we have behavioral mental health specialists that are available and able to provide emotional and mental health services to those who may need them. Ashley had mentioned the number, and that contact is available, and we would strongly encourage people to utilize those resources. The needs may vary depending on the timeline. Some people may need resources immediately, some at a later point in time, but having access to those resources is absolutely critical, as we've learned through these mass casualty and other significant events that occur.
Okay, and just to reiterate again, the Children's Wisconsin team has established a mental and behavioral health support line for families who need emotional support. That line will be active at noon today. That number is 414-266-6500. Okay, so I think this one would be for Dr. Drendel. You mentioned that a patient was admitted around 5:30 last night. Do we know when the last patient was admitted?
We continued our disaster response between 5:30 and 9:30 last night, where the vast majority of patients arrived. However, we continue to receive patients throughout the evening as transfers from other facilities until late into the night. So I believe our last patient arrived around midnight. So the patients continued to arrive as their injuries were identified and the ongoing care needs were identified that here at Children's we were able to provide.
Okay, and to reiterate, those patients, the reason it took them so long to get to us was because they were admitted to a different hospital, checked on, and then transferred to Children's for care. Okay.
That's right.
Okay. Looking through some questions here. Let's see if we have any that we haven't answered yet. Can you talk to, let's have Dr. Gutzeit address this one. Can you talk to the importance of having quick response teams there, teams like EMS and people trying to take care of the patients before they got to Children's Wisconsin? I think we touched on it earlier.
Yeah, and I would like to reiterate that Dr. Drendel spoke very well about the appreciation and gratitude we have to those first responders and other hospitals that provided tremendous support and exceptional stabilization of patients. That is so critical, especially in the first few minutes after an event like this. Providing that stabilization allows the child the best opportunity to have the best outcome. And so the teams that provided that support, whether it was in the field or at other hospitals outside of Children's Wisconsin, did an exceptional job, and the patients that were transferred to Children's allowed the team there to pick up that and that care and continue on the trajectory of care that was necessary, as Dr. Drendel mentioned.
Yeah, I'd like to reiterate, the EMS providers responded at the highest level in the care of these children. It was phenomenal. Very proud to be a part of this community.
Okay. I'm going to give Dr. Gutzeit a chance to do a quick closing after this. Just wanted to reiterate that we have that mental and emotional support line for families at 414-266-6500. For updates from Children's, stay tuned to our social media accounts as well as our website, childrenswi.org. And Dr. Gutzeit, I'm going to toss it over to you for a closing.
First of all, I'd like to thank everybody for attending this conference today and for the questions that were asked to provide as much perspective as we could at Children's Wisconsin here in Milwaukee. It's important to understand, as we've mentioned several times, and keep in mind the impact these events have on the community. And I want to emphasize that the resources that are being made available to the school districts, by the state of Wisconsin, by the school districts, and by Children's Wisconsin are available to those who need them. I'd like to encourage people again to use those resources. And I'd also like to thank the community for their tremendous outpouring of support to the staff and providers and all the children who are caring for the kids during this very, very difficult time. The words of encouragement on social media, the offers to donate blood, the offers to offer food to our staff who are working diligently and tirelessly to provide exceptional care to patients is genuinely appreciated. This is a community tragedy, and we will respond as a community. So we'd like to thank all of you for that support.
Okay. Thank you, everybody. We will be sending out a Dropbox link that has a recording of this for your use. All right. Thanks, everyone.